Visit ArriveAlive.org to find out more. Arrive Alive, drive sober.
You're watching Rogers TV, Barrie.
Update for Simcoe, Muskoka. To date, we've had 34,137 confirmed cases of COVID-19, which is up 1,097 since February the 9th, when I last reported. We've had, in fact, more cases of COVID-19 test positive reported to us in this fifth wave than in all previous waves combined. To be specific, in the present wave so far to date, we've had 17,447 cases, compared with 16,690 cases that had occurred in all four previous waves combined. We've had 106 deaths, which is higher than the deaths that have occurred in all the other waves except for wave 2, where we had 143 deaths. Our hospitalization rate and ICU admission rate, ICU occupancy rate, is actually higher in this fifth wave than in any previous wave. So the hospitalization rate has been 4.2 hospitalizations per 100,000 population over the course of this wave. And the ICU admission rate has been 0.8 ICU admissions per 100,000 population, which is the highest that we've seen compared with previous waves. And the average weekly deaths we've had in this fifth wave at 11 is higher than any previous wave, even though there were actually more deaths in the second wave. That was over a longer duration of time, so a lower rate of death per week. We've had a downward trend in our incidence of cases, riding in parallel with the province's incidence, and are slightly higher than the provincial incidence right now per 100,000 population per week. So our case count now is 20% lower than it was a week ago, 172 per 100,000, which equals 124 per 100,000 population per week, compared with the week before, January 30th to February the 5th, at 947 cases. And the province's incidence of cases right now is 19 cases per 100,000 population per week. So that's slightly lower than our 124 cases per 100,000 population per week. And we actually have a higher number of cases at this point in time per week, like at this point, the last week, than at the peak of the third wave. So we still have a very high incidence of cases, quite a substantial amount of transmission still happening in our communities, which really drives home the point that people need to be very cautious now, that avoiding transmission and becoming a case. Even though we are improving quite significantly, as is the province. The risk among the unvaccinated is 4 times higher for hospital admissions, 9 times higher for ICU admission, and 3 times higher for death compared with people who have 2 or more doses of vaccine. And this is data from Simcoe, Muskoka, from July the 18th to February the 15th. And our percent positivity is continuing to decline now at 10.2% versus 12.6% a week ago. And this is lower than the provincial present percent positivity at 14.7%. percent positivity being the percent of our tests that are positive. And it's an indication both of the amount of transmission happening in the community, but also the amount of testing taking place, the sufficiency of testing taking place. And those are very high rates. Anything above 3% is higher than is deemed to be desirable. Presently, we have 43 individuals hospitalized from citizens in Simcoe, Muskoka, down from 44 last week. And 12 of these are in the ICU, which is up from 10 last week. So hospitalization remains high and ICU admissions remain high. We've actually had some reduction in hospitalization over the last few weeks, but ICU admissions remains high and has not yet come down. The individuals in hospital right now range from their 30s to their 90s. 74% of them are greater than 60 years of age. And 4 of these individuals are under the age of 45. 34 are from Simcoe County and 9 are from Muskoka. 5 of them are associated with institutional outbreaks and 38 are sporadic cases in the community. 16 of them, making up 37% of the total, are not vaccinated, including 6 of the individuals who, of the 12 who are in the intensive care unit. 15 of these individuals, making up 38% of the total, have had 2 doses of vaccine, and they make up 5 of the individuals in the ICU. And 4 are partially vaccinated, meaning that they've had a single dose, and 8 have had 3 doses of vaccine. Of those who've been tested for their subtype, only 1 is Delta. The remainder are Omicron or have the marker consistent with Omicron, the S gene target failure. We've to date had a total of 389 deaths, 11 in the last week. And I would like to express my condolences to the family members for your loss. These people range in age from their 50s to their 90s. 8 are males, 3 are females, 1 from Muskoka, 10 from Simcoe County, 4 are associated with institutional outbreaks. And 6 of these individuals had 2 or more doses of vaccine, and 5 of them were unvaccinated. With regards to outbreaks, we have a downward trend. So 32 of the, we have 32 outbreaks right now, down from 40 last week. And just a reminder that we are only following outbreaks in congregate settings, healthcare institutions, long-term care facilities, shelters, and retirement homes, hospitals. And so there are undoubtedly other outbreaks in the community and workplace settings and other community settings that we do not know about. So of those facilities that we're following, 32 are an outbreak, down from 40 a week ago. And 6 of these 32 are in congregate settings. And this would be 1 shelter, 1 group home, 2 other congregate settings. Actually, that would be 4 congregate settings, not 6. 6 is what it had been last week. We have 18 institutional outbreaks, down from 22 last week, 2 hospital units and 1 correctional facility, 9 long-term care facilities, which is unchanged, and 7 retirement homes, which is down from 9 last week, and 10 childcare settings, down from 12 last week. We continue to make progress with regards to immunization. We have provided first dose vaccination for 88% of our population 12 and over, and 85% second dose for that age group, 12 and above. And for the adult population, 55% of those 18 and above have had booster doses, 71% of those 15 above, and 83% of those 70 and above had booster doses. We currently are booked for over 700 booster doses, and we do have capacity for more people to come forward. And certainly I want to emphasize the importance of people getting their booster dose. 2-dose vaccination provides some protection against severity, but not really against becoming a case of transmission. 3-dose vaccination provides a fair amount of protection against transmission and much higher protection against severity, including hospitalization, ICU admission, and death. Though not perfect, as we've seen, there have been breakthrough cases that have resulted in ICU admissions and deaths, even among those who have 2 or more doses of vaccine. So vaccination very important, but the other control measures are also very important, that people continue the multi-layered approach with mask use, physical distancing, and self-monitoring, isolation if they develop symptoms, and hand washing and determination of carefully if you in fact want to be going out to venues where you could get exposed. With regards to child vaccinations, 48% of our children 5 to 11 years of age had their first dose of vaccination. And we do have lots of capacity for children to be able to come forward and get vaccinated. And we did have success a week ago with vaccination at 3 schools. And so we will be proceeding with other schools, and I'll be providing a bit more information about that shortly. We do continue to monitor detection of COVID-19 in the wastewater of 4 of our municipalities, Barrie, Collingwood, Midland, and Orillia. And what we're noting right now is, although they peaked and come down quite a bit, they appear to be plateauing at the moment and still at quite a high level compared with before this 5th wave. So that too would be another indicator of risk of transmission in the community at this time, still substantially high, even if it has come down from the peak quite substantially. It's still elevated compared with previous waves. On the Ontario COVID Science Advisory Table website, there is now information about wastewater monitoring broken down into sub-regions across the province. Is very good information, showing in most locales there's a downward trend or plateauing downward trend. In the north, there's actually an upward trend beginning again. And our monitoring dashboard remains in red status because of high transmission and high percent positivity, as well as the inability or the capacity of the public health system not being in red status. Okay, we do have some changes on our health stats website. So this is something that evolves over time. And we have removed confirmed case counts for Simcoe versus Muskoka, as I'd indicated a week ago. And this is because we don't have sufficient quality of data to be able to make that distinction reliably. And so we have combined data only. I am giving verbally information where I can about Simcoe versus Muskoka related to hospitalizations and mortality, as I've already related today. And although that information won't be up on our website, I will continue to provide it verbally to the best of my ability when, as I have it. We've removed tables that identify individual outbreaks associated with case counts by setting. And we do have the incidence rate table and chart found on the COVID trends over time page. And we also have a video on our landing page and our vaccination page explaining hospitalization and ICU stays among the vaccinated and unvaccinated cases. So giving an explanation as to why we can see quite a substantial number of cases, or percent of our cases that are hospitalized being people who are vaccinated. And it really comes down to the fact that although these groups gain substantial protection against hospitalization and ICU admission with vaccination, it is not perfect. There are still breakthrough cases. And when the majority of people are fully vaccinated, you're going to see that they represent a very large portion of the cases overall. The bottom line is the risk for individuals who are unvaccinated is still substantially higher, much higher, of having severe disease than for those who are fully vaccinated, and even more important that people get the third dose, the booster dose. And it's very important that everybody exercise all of the other protective measures that I've cited, given that you can get breakthrough cases happening among the vaccinated. So on Monday, the province announced that they would be proceeding on Thursday with a further opening and easing of restrictions in public venues. One thing I would say is, as we proceed with that, it's important to know that the risk of transmission is still high, that even though people are able to attend restaurants now at full occupancy with proof of vaccination at this time, transmission can happen in those settings. And that people need to be aware of that and decide for themselves what risks they want to take, and to use all of the protective measures that they can. So being fully vaccinated and having a booster dose, use of masks, physical distancing, hand washing, self-monitoring, isolation, all very important to be continued. Because we still have a high degree of transmission happening. So we're heading in the right direction with a downward trend, but we have a high degree of transmission, and there's still a high degree of risk. One thing I would say is we do have an opportunity for booster doses now for youth. So those that are 12 to 17 years of age, as of Friday, will be able to get a third dose, a booster dose. And this is for all youth. Formerly, it had been available for youth who are identified as high risk with medical conditions, or a member of the Indigenous community. However, now it's available for all youth 12 to 17 years of age who received their second dose of vaccine at least 168 days in the past. So that's actually a longer interval than the other groups who are eligible to receive the booster dose. The other groups, including the youth at high risk of transmission due to medical conditions or being a member of the Indigenous community, can get their booster dose 84 days after their second dose of vaccination. But for the general youth population, 12 to 17 years of age, it's 168 days after their booster, after their second dose, to be able to get their booster. Certainly would advise people to have a look at our website or the provinces with regards to what is allowed and what isn't allowed. So gathering limits have now been increased to 50 people indoors, 100 people outdoors. Capacity limits for indoor weddings, funerals, and religious services, rites, and other ceremonies will also increase to the number of people who can maintain 2 meters distance. And capacity limits are removed for those locations if the location opts to require proof of vaccination for these events. I'd already cited capacity limits for restaurants is being set at 100%. So the capacity limit indoors for public settings such as grocery stores, pharmacies, retail, and shopping malls will be maintained at or increased to the number of people who can maintain 2 meters distance. Capacity limits in indoor public settings where proof of vaccination is required are also lifted and include restaurants, bars, and other food and drink establishments that do not have dance facilities in operation. Non-spectator areas of sports and recreational facilities, including gyms, cinemas, meeting and event spaces, including conference centers and convention centers, casinos, bingo halls, and other gaming establishments, and indoor areas of settings that choose to opt in to proof of vaccination requirements. And then public settings such as sports arenas, concert venues, and theaters will now allow 50% of their seating capacity, while indoor capacity limits of 25% will exist in higher risk settings where proof of vaccination is required, including nightclubs, restaurants where there is dancing, as well as bathhouses and sex clubs. We will provide updated guidance information on our website based on new regulations that have just come out in the coming days. And then the province also announced that starting May 1st, they'll be proceeding with further capacity limit lifting and with a discontinuation of the proof of vaccination requirements in all business settings. Businesses and other settings may choose to continue the requirement for proof of vaccination. Masking requirements will remain in place at this time. So I want to emphasize once again that transmission is still high, and that it's really important that people maintain the multi-layered approach to their best of their ability and become fully vaccinated and get booster doses as they're eligible to. And as these limits are lifted, the risk persists. And just because they're being lifted doesn't mean there isn't risk. There is risk, and people need to keep up these precautions to reduce the likelihood of themselves becoming cases and to determine for themselves what they would choose to partake of or expose themselves to, knowing that the risk persists. So with regards to boosters, I've already identified that the province on Friday will be allowing booster doses for those 12 to 17 years of age. And individuals can book through the provincial booking system, but we do accept walk-ins as well at our community clinics. They can also obtain vaccination, or will be able to, at pharmacies that are participating. And we do have information and on our website about such locations. We continue to provide vaccination for children 5 to 11 years of age as well. As I said, we have lots of capacity for children, people to book for this or to drop in and receive vaccination. I certainly would advise other family members to come with them who've not been vaccinated as well. And we are looking to provide more vaccination clinics in schools. We had high success with the first 3 schools that we did this with, very good participation, both during the day for the children themselves as well as teachers, but also in the evening, open to the community for other members of other ages to attend. And so we will be proceeding with booking a range of other schools starting next week, and we'll have that information up on our website. We found that there's a really strong indication of interest via parents who've signed consents to receive vaccination for their children in school. Some 2,600 consent forms have come back via Simcoe County District School Board. And we expect more from the Trillium Lakeland School Board and the Simcoe Muskoka District Catholic District School Board by end of this week. So a strong showing of interest. And thus we believe that this is a valuable thing for us to continue. But I do want to emphasize for those who are interested that by all means, they don't have to wait for that. If they want to come forward and attend one of our community clinics, please do so. Also a reminder that to keep our schools safe, parents need to continue to screen their children using the screening tool from the province, which has been updated and is more detailed with regards to its direction based on your responses to the questionnaire. So it is very important that you complete that every single day before sending your child to school. It helps to keep the school environment safe. So at this point, and also if your child is, as some indicated to be required to stay home and isolate from that questionnaire, that they should do so, as well as following the direction with regards to others such as siblings and other people in the household. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. As you mentioned, we will now take some questions from the media. Just a friendly reminder that we ask that those who are participating to please limit yourself to one question and one follow-up in consideration of time. Can we start with Mary Beth Hartle from Muskoka Region? Do you have a question this afternoon?
No, actually, I'm fine. Thank you.
Thanks, Mary Beth. Chris Simon from the Barrie Advance, do you have a question this afternoon?
Of course I do. Hi, Dr. Gardner.
Hello.
If transmission is still so high, why are we loosening restrictions so much?
Well, I think that's a very good question. And I had some interviews yesterday as well with the media about that in my capacity as chair of the Council of Medical Officers of Health. My own view is that it's happening a little early. It's earlier than the province really originally indicated. And thus there is an increased risk. I know that the Chief Medical Officer of Health feels that it's heading very much in the right direction and feels confident about being able to move in this direction from the point of view of hospital capacity and impact on the healthcare system, that he feels confident we can do this. But I think it's important for people to know on an individual level for themselves and their family members, their loved ones, that there is still substantial risk. And as we open up, they need to be aware of that and make decisions to protect themselves. And I would also say that as medical officers of health, we will need to monitor the trajectory and to see if in fact it starts to reverse itself and possibly result in a second wave or surge of Omicron, given that the science table did identify that possibility with their modeling released 2 weeks ago.
And for my follow-up, the health unit has gone from providing really detailed case information, outbreak information, to just not being able to do that. I understand why, but one, does it disappoint you that you've had to scale back the information that you're able to release? And two, do you blame any particular agency, any level of government for lack of funding or anything like that?
I think those are good questions. I think that through most of the pandemic, we've been able to provide a very high level of detail with regards to case and contact identification, outbreak identification, much higher than I think was originally envisaged for a pandemic. If you go back to the pandemic planning that had been done, 20 years ago, 15 years ago, looking at pandemic influenza as a real possibility. It was only the very earliest portion of the pandemic in which you'd be able to do this kind of detailed case and contact follow-up and detailed follow-up of all outbreaks, and that you then need to move to a phase where there's broad public messaging instead, and a reliance on people to follow it to the best of their ability. Our actual experience with this pandemic is we were able to keep up that kind of detail much longer than what was originally envisaged with pandemic planning. And so with that in mind, I would say I wouldn't blame anyone for that in particular. I think that was part and parcel to what we originally expected. I think the failure in the end to be able to keep that up was really a function of just how much more transmission happened with this latest variant that is so much more transmissible, and thus it just wasn't possible to keep it up. And we were essentially moved into that final phase of managing it in a much broader way with messaging than we were able to keep up earlier.
Thank you.
You're welcome.
Sean Gibson from Barrie Today, do you have a question?
Yes, thank you. When we headed into the winter months, the colder months, there was a concern of cases going up. What do you foresee as we head into hopefully some warmer weather soon? With Omicron, are we still in a bad spot, or will it get a little bit better, do you think?
I know that there is some degree of optimism. I think provincially, there's optimism that we're heading fairly quickly in the right direction. I also know that the science tables modeling projected a real possibility of a resurgence or a prolonged recovery. The numbers that we now have, hospitalization numbers, actually align with the most optimistic trajectory for those models. So that's good news. I also note that it's around now in that model that you would begin to see the rise of cases. So right now is I think a very important time for us to be watching whether or not it continues to go down, or whether we see some evidence of it rising again, whether we see an increase in cases or the wastewater monitoring start to show an increase. So we might have a better sense of how optimistic we should be in a week or two. But at this point, it looks favorable. I note that the pandemic has been ever unpredictable, and that we've had 5 waves so far here in Ontario, and that COVID-19 has proven its ability to generate new variants that are more infectious than previous variants. So that possibility certainly persists, still exists. And there's always the question, even if we do well in the spring and into the summer, what will come with colder weather again in the fall? COVID-19 is a respiratory virus and follows the colder months, much like other respiratory viruses. So there's that question too about what will come later in the year.
And the follow-up is, if this was too soon to head out of some restrictions, what was something you would have looked for on when it came to easing restrictions? What is something that you would have thought, yeah, that was a good time we could start that, if this was not the best time?
Well, I often think of the modeling from the science table, and given their timeline and the fact that they would be predicting it would be in the next week or two, you would see a rise, that I'd be looking for that. And if in fact we continue to go down instead of up, I would see that as a favorable sign that we could begin to open up. So that would be giving it, another week or so anyway, more akin to the original timeline that the province had in mind of opening up on beginning to open up again on the 21st instead of the 17th.
Thank you.
You're welcome.
James Bowler from Cogeco, do you have a question this afternoon? Okay. Matthew Riesler from Moose FM, do you have a question?
Yes, thank you. Hi, Dr. Gardner.
Hello.
You mentioned that the reasoning for the changes to how the case count is being reported is because there's a lack of sufficient quality of data. Could you just expand on what you mean by that?
What I mean by that is that we get well, for one, you're only doing testing of people who live or work in congregate settings, the high-risk settings, and hospitals. And so you don't have a sense as to what's happening throughout the whole community just in those settings. But for another, the volume of tests that have come back have been so high that we haven't had the capacity to do all the data entry required to be able to sort all of that out. So for those reasons, we don't feel we have sufficient handle to be able to reliably separate out even between Simcoe versus Muskoka.
Now, I know the talk about this has died down recently, but early in the pandemic, there was a lot of talk, at least from Muskoka residents and those we talked to, about separating the case count numbers and the data between Simcoe and Muskoka because there was so much of a discrepancy between what we were seeing in Simcoe County between the district of Muskoka. So is it concerning to you that now a lot of that data is now going to be grouped together and without really a way for people who are looking at it on the Health Unit's website to differentiate what is happening in Simcoe versus what is happening in Muskoka?
Certainly that was a concern all the way up to the fourth wave, that there was a substantial difference in the incidence in Muskoka versus Simcoe, and in particular South Simcoe. But with Omicron, that difference vanished. While we were still able to monitor them separately, we found that in fact Muskoka and Simcoe were riding at a very similar level of transmission. And that was just a function of how very transmissible Omicron is. It didn't seem to matter where you were in the province. It was going to find people. And it was at least as common, actually at this point, more common in the northern Ontario, than it has been in the urban centers in the south. So on the whole, at this point in time, I don't actually, I don't see that concern at this time because of that.
Dana Roberts from CTV, do you have a question this afternoon?
Yes, I do. Good afternoon, Dr. Gardner.
Good afternoon.
Okay, so obviously frustration is high, and frustration has been high throughout the last 2 years. But I think it's fairly safe to say it's never been this high. With that in mind, are you concerned about people losing faith in public health in general? I mean, including COVID, but just overall with any messages that come from public health from now on? Are you worried about that?
It's always very important that people trust us to provide honest and clear messaging and advice. And we strive to do that. My colleagues strive to do that, to be transparent, to indicate the degree to which we know things or can know things, or when we cannot be certain of things. And so I've indicated that with the limitations of the data now. And case in point would be the case count and how it's difficult to compare with previous waves because we haven't been able to keep up with the degree of testing. So very important that we be transparent and we be trustworthy and give the very best advice that we can. I know that people, all of us have had a hard time with this pandemic, that it's been tragic for many who've lost loved ones, very hard for people who've had major negative impacts on their businesses or their livelihood, very hard on us all about losing activities that have been very important to us, important to our mental and physical well-being. The very long durations that children have been unable to attend school in person. That's been very, very hard on us all. And now we have quite a substantial opposition to public health measures And there's been some of that earlier in the pandemic as well, although I agree right now it's very, very high. And I think in the end, people have to decide for themselves who they will trust. And all we can do in public health is do our very, very best to be trustworthy and to provide good information to the best of our ability. That is what we strive to do. And I believe that most people still turn to us as a trusted, reliable source of information and guidance, even if there are many who do not.
Fingers crossed. And my second question, over the last couple of months, we keep hearing the word endemic thrown around. And I think lately it's being thrown around arguably too casually. So with the idea that restrictions are loosening, are we at that endemic phase, or are we just at the phase where politics has taken over and said, we got to open up?
Well, the decision to open up, of course, is a decision of the provincial government. And government has to take into account many things. There's public health advice and health concerns, but they must take into consideration other concerns, economic concerns as well. When it comes to this question of being in an endemic phase, what that really means is that the level of transmission has dropped to a point and it's somewhat at a steady state with some fluctuation. And we would want to do what we can to have that at as low as possible, or at least low enough that we can manage, low enough that the healthcare system can manage the number of cases that are occurring, and also have in place the means by which people can reduce their risk. So vaccination has been critically important to get us where we are now. If we didn't have the level of vaccination that we have, we would have seen much, much greater numbers of people with severe disease and much greater mortality with the Omicron wave than what we did see. But to me, I don't think we're yet at what you would call an endemic state. We're still coming off of the fifth wave and not at the point in which we're at a much lower level of transmission and a somewhat of a steady state. That has not happened yet. We shall see what happens, how long it takes to get to that, what happens through the spring. Hopefully, we will have that experience coming out of this wave and going into the summer. There is the concern about the fall and the potential for some resurgence with colder weather. Again, there's a potential for new variants that could lead to future waves. So it's really impossible to be able to predict the course of the pandemic. And I think that people need to be aware of that and to know that there are things they can do to reduce their risk. Right now, while you still have high transmission, and will remain important going forward in time, even when you have a lower level of transmission.
Mark Claremont from Muskoka Today, do you have a question?
Yes, thank you very much. Dr. Gardner, emergency powers in Ontario last week and federally this week, do they have any impact on the Simcoe Muskoka Health Unit? And does it provide you any added powers to work with?
Yeah, thank you for the question. We in public health do not have additional powers. We actually have substantial powers all the way through the pandemic. The ability to issue letters of instruction to businesses and organizations under the Reopening Ontario Act, and the ability to issue orders to groups of people and to individuals under the Health Protection and Promotion Act, as well as the ability to issue fines and tickets related to infractions such as under the Reopening Ontario Act or the Health Protection and Promotion Act. So we have significant powers. The powers that come with the declaration of an emergency provincially and federally rest in other areas with provincial and federal government overall with police authorities, but not with public health.
Okay, thanks very much. So, not to jump the gun or anything like that, but are you able now to step back, catch your breath, given the fact that you're still in the midst of a serious health crisis? Are you thinking ahead 6 months, 1 year, 2 years, given what you know has transpired over the past 2 years? And are you able to get your head around that? What do we, the health unit, need to do to prevent something else happening next fall, next year, and the year after?
What's very much on my mind, and has been actually throughout the entire pandemic, is the recovery of our other programs and services. And the movement of our staff who've been redeployed to COVID work back to those other programs. And because of the course of the pandemic, we haven't been able to succeed in those fronts as yet. And as I see the case counts coming down now, we are looking again at how do we get back to doing those programs, and what is priority to start at the beginning of all of that. So we do have a prioritization approach in mind. And actually, all of public health does as well. I've been involved in the development of a discussion paper from the Association of Local Public Health Agencies on public health resilience and recovery that identifies the areas of priority to commence earliest, such as catching up with vaccinations that we've not been able to keep up for children and youth, or being able to respond to the opioid crisis or mental health needs, and getting back in place some of our inspection programs again, such as food safety. So that's on our minds. That's on my mind. We are looking at how do we start to get our staff back to that if things continue to slow down with regards to COVID-19 and the demands of COVID-19. We're also aware that they may not slow down right away. You might get a resurgence again, or you will probably see some future variants again that we would have to respond to. There is the upcoming potential to be vaccinating children who are under 5 years of age to be prepared for. And there's a possibility of future vaccination campaigns with new vaccines for COVID-19, potentially in the fall or at a later point. And we're starting to look at how would we do that while we get our other programs up and running. We've taken to our Board of Health and got approval for a budget that includes additional funding from the province for that kind of recovery work and the ongoing response to the pandemic. So that really carries us through at least to the end of this year. There's a lot of unknowns that would come with the election as well, and what provincial government priority may be following the election for public health and the broader healthcare system. All of that is unknown to us. We do know that we're almost certain to be participating in reviews of the response to the pandemic and reviews of the public health system and how it should be changed as well. So that would carry us, I'm sure, well into 2023.
Okay, thank you very much.
You're welcome.
Are there any questions from the phone line this afternoon? Okay. And was there anyone who didn't have the opportunity to have their question answered today?
Kara, would you mind if I asked another question?
Sure, go ahead, Chris.
Thank you very much. Recognizing that this is asking Dr. Gardner to comment on something political, I was wondering if he wanted to say anything about Premier Doug Ford's comments yesterday that appeared to question the efficacy of booster doses.
Well, there's no question from the evidence that booster doses are quite effective in reducing transmission, the likelihood of becoming a case, probably in the range of 70%, and highly effective in reducing severity, hospitalization, ICU admission, and death, probably in the range of 90%. And that's quite substantially higher than 2 doses. So you go from really almost no protection against transmission and maybe 70 or 80% protection against hospitalization with 2 doses to quite substantial protection against infection and 90% protection against hospital admission, ICU admission, death. So I think the boosters are actually very important.
Thank you.
You're welcome.
Hey, Tara, rather?
Hi, Mark. Do you have a follow-up question?
Yeah, Dr. Gardner, sorry, I'll let that go. Regarding vaccine passports, so there's a lot of, apologize, just hanging up. Sorry about that. So there's a vast, you mentioned today, changes going on all the time. The government issuing different orders and capacities and this and that. And how does a business get their head around what's changing and possible to do? Vaccine passports are supposed to come off, I believe it's the middle of March there. Would you support restaurants and that, I guess that sort of thing, still requiring vaccine proof, scanning proof to get in the restaurant?
Yeah, good question. According to a provincial announcement, as of March 1st, they would be discontinued, but could be supported for businesses to use. And I would certainly support any business that wants to continue with proof of vaccination. I would certainly support them if they wanted to go up to a 3-dose requirement, although that might be challenging for them in that there are many people in the adult population who've yet to get their 3rd dose. But nevertheless, there'd be a rationale for that in that it's much more protective, including against transmission. So I would be supportive, and I believe that my colleagues across the province would be supportive of such businesses.
Oh, okay. Thanks very much.
You're welcome.
Are there any further questions this afternoon? Okay, I believe that brings us to.
Art.
Hi.
Hi. Yeah, I just I understand all the complexities of the private sector and a variety of different facilities that have different restrictions and what's loosening. From a municipality perspective, we've been basically designated as a government closest to the public, and our standards have been a little higher. We still have vaccination policies in place. Can you give us any indication on whether those vaccination policies may continue or will they change as a recommendation from the health unit?
So are you a member of the media?
No.
I'm sorry, but this is not the venue for others.
Fair enough. I apologize, Dr. Gardner. I'll ask the question.
We will be having our CAOs weekly, every other week now, meeting tomorrow.
Okay. Thank you.
Okay. You're welcome.
Thank you so much. I believe that brings us to the end of our media briefing this afternoon. Dr. Gardner, thank you so much for your update, and thank you to the members of the media who participated today.
Thank you, everybody. Have a good day.
Recording stopped.
with technology. And I can cite a perfect example of that is in the States over the last few years, there have been 3 or 4 brokerage models that have come forward that have tried to present themselves and market themselves as being virtual automated processes. You don't have to go through all the frustration of dealing with a realtor. You can, you can do it all electronically. And these models stick around for a year or two and then they're gone. So, I mean, that's people raising their hands to state whether or not they want to replace